Health Watch. Now, a lot of people are looking into cosmetic surgery options after seeing Kris Jenner's new look. Now, a lot of people are saying the 69-year-old mother of 6 looks like her daughters. So what is she really doing? Let's bring in Dr. Matthew Knight right now. He is the president of Knight Dermatology Institute, also a member of the Florida Board of Medicine. Always love having you. Dr. Knight, thanks for being here.
Thanks for having me again.
Okay, so let's talk about this because there are a lot of things that go into this, right? We don't know what Kris Jenner has done to look so young and beautiful, but there are a lot of people who will assume what she's done, right? And as a doctor, you can probably tell when you see someone like, oh, I think you've done this or that, a little nip and tuck, or maybe it's just something that you can do in your office.
That's true. Yeah, usually a doctor can tell, and in that case, I mean, I think it's done really appropriately. I think she looks great. I know we're all aware of people that it doesn't look great, and there's a reason for that, but I want to talk briefly about what this stuff is. So botulinum toxin type A started to be used in the 80s for people whose eyeballs were stuck one way. That's called strabismus. So if you injected their eyeball straighten out, there's another condition called torticollis where kids' necks, they're stuck like this and it's really painful. And in the 80s, they learned that they could inject that with botulinum toxin and their neck would be normal, and it was really cool. And some smart person realized that if you inject that in the neck and around the eyes, their people's appearance and wrinkles got better. And so we started to use it for aesthetic reasons, and it's really powerful. This is the #1 cosmetic drug in the world right now, and it's really easy to use, and it's really, really safe. The thing is, it's not about wrinkles. Like my 7-year-old has wrinkles, so we're not chasing wrinkles. We're affecting the way that brows look by affecting these muscles, and it takes a lot of study. The other part of it are these fillers. These are nature identical, so this is hyaluronic acid. Our bodies have hyaluronic acid in them, and so we're replacing what we used to have. As we age, we lose bone and soft tissue, so things start to fall, and by injecting them with nature identical things, we can make a big improvement. But you can totally go overboard on this stuff. And so if somebody comes in and they say, I want 8 syringes of filler, or I want my lips to look gigantic, the answer is no. These are tools to help people look younger and more refreshed, not to look different. All
right, so Doc, let's talk about age appropriateness, right? Because we do, we talked about this last week about the TikTok trends, right? And people see this and they're like, there's a 17-year-old girl and she's asking if she can get Botox. And so when is the appropriate time to start so that you don't get those deep wrinkles, but also so that you don't look phony?
So you're talking about baby Botox.
Yes.
I mean, I think we all agree that under 21 years of age is no bueno. If you're using it for strabismus or migraines, another use for this stuff, then it's fine. But in your mid-20s, it's appropriate. And the idea is that if you've got a really, what a dermatologist would call hyperdynamic area, an area that's moving a lot, that you can inject that and keep it from forming these deep-seated wrinkles over time. So if your muscles can't grab your skin and squeeze it like an accordion over and over again, in your 30s and 40s and 50s, you won't have those deep-set-in lines. And I think that's appropriate, but you got to be careful that you're not setting the framework for somebody who's going down this rabbit hole of body dysmorphic disorder, especially with social media infused into this, where they're seeing these things and trying to achieve this impossible vision of beauty.
Well, and like we were talking about this in the commercial break, about what does that mean when you say that body dysmorphia? And your analogy was that somebody who might have anorexic tendencies, right? Like what they see in the mirror versus reality.
That's right. I mean, it's a slippery slope, and so it usually starts with a little mole or a little line or something that oftentimes we can't even see, and to the affected person, it's all they see. And so they go down this rabbit hole of more and more and more product, and these people will come in and they say, look, I want a bunch of filler to fix this problem, and you look at it and there's really no problem. You have to help educate them about what's going on, just like anorexia. It's more of a mental health counselor that's going to help that person as opposed to a syringe of something.
Right. Is there an age that it's not going to help you, Doc? Because and we all talk about it, right? Like the 11s, like these are the lines that you get right here. They call them the 11s, right? Or if you have like deep crevices here around your, is there an age where you're like, okay, somebody comes to you and you're like, you're past the point that I can help you?
For sure. Okay. These things are just a tool, and they're often used with other traditional cosmetic surgeries. So this can be used in addition to facelifting or other things. For sure, people come in that want 6 or 7 syringes of filler when they really need a facelift, and the answer is that's just not appropriate. You'd be wasting your money on something like like this and have an appearance you don't appreciate. The one interesting thing we do find, though, I wanted to bring up, is that for a lot of people, having this stuff done is more of a status thing. So we have people that come in that want something crazy, like they want their eyebrows to shoot straight up in the air, or they want gigantic lips, and it's a status thing. It's like, look at me, I have the means and the ability to have these things done, and so I want this unusual appearance. The art and science of aesthetic medicine is help people look like themselves, but younger, not totally different. And make sure they don't go down this road of body dysmorphic disorder like anorexia, which can be really serious.
Yeah, we've all seen those disturbing before and after pictures of Hollywood celebrities, and you're like, wow, they don't even look good anymore,
well,
which
those
is
are
sad.
the ones that make the news.
Yeah, right,
You know, the worst case examples.
Yeah,
So.
Dr. Knight, always great to see you. Happy 4th of July to you and the
Happy
family.
4th of July.
Hope you have a great one.
Thanks, everyone.
Thanks always for coming.